Let us now discuss the basic concept, formation, and physiological actions of blood. Blood is a red liquid laden with rich nutrients and flowing in the vessels. It is one of the basic substances that constitute the body and maintain its vital activities. In order to carry out its normal actions, it has to flow within the vessels. If blood circulation is impeded or there is bleeding from the vessels, its normal actions will be impaired and blood insufficiency can become a cause of disease. Blood originates from two sources: essence of drink and food and kidney essence. Blood derives from nutritive qi and body fluids. These are both generated from the essential substances that principally the spleen and stomach extract from drink and food after digesting them. In that sense, the spleen and the stomach are sources of blood. Prolonged inappropriate diet or impairment of stomach and spleen functions can lead to blood deficiency. Next is kidney essence. Essence stored in the kidney generates bone marrow, and marrow in turn is transformed into blood. In CM, essence and blood can be transformed into each other. In general, if kidney essence is ample, the liver has its nourishment and blood has its replenishment. If liver blood is ample, the kidney has its store and essence has its supply. Thus it's said essence and blood have a common source. Now let us look at its physiological actions. Blood flows in the blood vessels. In the interior, it reaches the Zangfu viscera. In the exterior, the skin, muscles, tendons, and bones. It unceasingly nourishes and moistens the organs and tissues in the entire body, thereby maintaining their normal activities. This physiological state is reflected in a rosy and lustrous complexion, a well-developed and strong muscles, well-moistened skin and hair with sheen, and keen perception and agile movement. If blood is deficient, there may be dizziness, blurred vision, lusterless complexion, dry skin and hair, and numbness of the limbs. Blood is also the material basis for mental activities. If blood and qi are both abundant and smoothly flowing, then the mind is sharp, perception keen, and movement nimble. Abnormal circulation due to any cause like deficiency of blood, heat in the blood, or abnormal flow patterns can lead to mental disorder. In mild cases, there may be listlessness, insomnia, dream-disturbed sleep, and restlessness. And in severe cases, there may be confusion, dementia, delirium, and coma. Blood circulates incessantly in the vessels throughout the body to supply nourishment to all the organs and tissues. Normal circulation of blood requires coordination and balanced circulation. The lung controls the entire body's qi and is the convergence of all the vessels. It assists the heart in promoting circulation. The spleen commands the blood flowing within the vessels and prevents extravasation. The liver stores blood and regulates the volume of blood in circulation. It also helps to keep blood flowing smoothly. It can be seen that the circulation of blood is accomplished jointly by the physiological actions of the heart, the lung, the spleen, and the liver. If the function of any of these organs is impaired, blood circulation may be affected. Such abnormalities as hemorrhage, poor circulation, or blood stasis may result. In addition, cold or heat in the blood can directly influence the rate of blood circulation. Thank you so much for your attention.